Care to Drive program is a program where volunteer drivers collect cancer patients from their homes, drive them to the hospital, drop them, the patients go and have their treatment, and then they're collected again by a volunteer driver and taken home. It's a very simple program, but it's really profoundly helpful.
It means that a patient doesn't have to worry about driving through traffic in busy traffic jams. It means they don't have to find parking at the hospital. It means they don't have to walk across from hospital car parks into the hospital through wind and rain on bad days. It takes all of the stress out of getting to their appointments. And the other big advantage is they don't have to rely on family members and friends to be constantly available.
I take a train with a number of IBMers, and I asked somebody one day what he did for IBM, and he told me he was a software salesman. So I said to him that we were looking for a solution for Care to Drive, and could he, maybe go back to IBM and see if there was anything that they might be able to help us with. And Declan rang me then to say that he had some very exciting news and that IBM was about to embark on its 100-year anniversary, and that there was a program in place around volunteering for that. And we talked to them about Care to Drive and what our needs were. And it was really cool to watch them kind of process how this might fit with the centennial year and the year of volunteering and all of that.
Everybody knows somebody that's been touched by cancer, so there's a lot of sort of deep feelings towards making something positive, taking some of this smart technology that IBM has and transferring it into a domain that can make a difference.
I got involved in the project through one of my colleagues who's involved with the Irish Cancer Society. My aunt has died of cancer. I have another aunt that has cancer, and one of my close personal friends lately has just found out he's cancer as well. So to be able to work on something that will bring benefit hopefully to people in similar situations would be absolutely fantastic.
I've always had an interest in volunteer work, and the ICS is a wonderful organisation. It has provided care to so many cancer patients in Ireland. As a project manager, I will be coordinating all efforts to ensure that we deliver this project within the timelines that we have promised.
I've never got to use my skills, my core skills, my programming skills, my developer's skills in a voluntary capacity, and this is something that I jumped at.
I've been an IBMer for 15 years, and I'm the chief programmer and architect on the industry solutions team. We develop similar applications of what we're doing for the Irish Cancer Society, but on a larger and a broader scale.
I got involved in the project because I want to get more involved in the development side of computing. I work in testing at the moment in IBM, and also cancer has affected some people in my family. I'll be working on actually getting the website itself up and running.
I'm an architect in a team called the Defence Operations Platform, which provides a secure platform for military or civilian applications. My focus is going to be on a mobile application.
When I heard about this opportunity to volunteer for Care to Drive, I decided that this is a very good cause. I'm planning to apply some test automation and automated performance testing.
The idea is that we're going to bring this application to the cloud. It's going to be web-based.
We're developing a smart system that will enable the Irish Cancer Society to manage this Care to Drive program in a meaningful and seamless way that will make a difference not just for them but for the clients and for the drivers too.
Currently, the way that they're running their Care to Drive system, the Irish Cancer Society staff have to do pretty much all of the work. They have to make the bookings, they have to manage the driver calendars, they have to manage the patient's details being faxed into them. So when this new system is delivered, it will essentially put it online. It will allow the drivers to manage their own calendars. It will allow the care staff in the hospitals to enter patient details. It will essentially take a lot of workload off them and allow them to deal with more people and help more people.
It's going to improve our processes. It's going to mean that we can roll this program, this really special program, out all over Ireland for cancer patients in all of the hospitals. This service will be seamless, and that's what we want for people. We want to really reduce their stress. We want it to be something that they don't have to think about, that once Care to Drive says, yes, we're going to handle your transport, then that's all the thinking they have to do about it.
When the volunteers, the IBMers here in Ireland, realised that there were grants on offer from IBM, we thought that this particular project would really make, a good grant proposal or a good grant application. So we brought the idea forward to the committee. They loved it, and we've been very lucky to secure a silver medal or $75,000 that we can donate to the Irish Cancer Society.
We're going to be able to invest in the hardware and software that we're going to need to take this program forward. We're going to be able to also train the volunteers and the members of hospital staff who are going to be using the service and create manuals and documents so that that training can last over time. We're also really keen to look at the possibility of using smartphone technology.
For the project to be seen by IBM Corporate to be such an important project, it's actually fantastic.
The collaboration with IBM is really important for the Irish Cancer Society. It's going to put us first in the world for something like this. We've done lots of research. We've been checking out what's going on in the States, in Canada, in the UK, Australia. Nobody has a system like this.
And you usually end up getting a whole bunch of new skills and working with new people as well.
I'm learning a lot more about how development projects work.
Usually on your day-to-day work, you're in midstream of a product that's only adding a couple of features. This time you're going to be actually doing start to finish and delivering something at the end, so you'll actually see the full life cycle.
This was an opportunity to spread out and do a bit more within the voluntary community, and also for me to tell what is a worthy cause, but also to work on technologies that I don't work on every day.
Volunteers are critical to the work we do, and it's great to see a new bunch of volunteers like the IBM volunteers coming in.
Care to Drive next meeting.